What do we know about modern cancer risk factors? I'm Marco Perry. Welcome to the Perry Platform. The Lancet put out a study titled The Global Burden of Cancer Attributable to Risk Factors. It opens by saying understanding the magnitude of cancer burden attributable to potentially modifiable risk factors is crucial for the development of effective prevention and mitigation strategies. There are a couple things to understand here, both on the disease front and on the healthcare front. Starting with the disease front, when we talk about risk factors, we talk about things that can increase your likelihood of developing cancer. And there are fundamentally two ways that one can acquire this disease: genetically or through engaging in risky behavior that comes with carcinogens. And this is what we call risk factors. Now, the tricky thing is that these buckets are not independent. The risk factors can often interplay with the genetics of a person, and the genetics can interplay with the risk factors. You might smoke cigarettes, and that can make you develop cancer sooner, but at a genetic level, you may be predisposed to cancer from the get-go. And another behavior, whether it's cigarettes or not, could have triggered this. So it's hard to parse these two things, but there are ways to approximate. Now, when it comes to healthcare, on one hand you have things like prevention and mitigation, and on the other you have treatment. Of course, it's good to develop competencies in both. If your mitigation and prevention strategies are tuned up, presumably there would be less need for treatment. And you often hear that saying, an ounce of prevention is worth a pound of cure. This flows from the natural consequences of cures typically being expensive, whether that is drugs, chemotherapy in this case, other forms of treatment like surgery. These things cost a lot. And if you can modify risky behaviors at the prevention stage, there stands to be a massive cost savings and overall reduction in cancer rate to begin with. Now, back to the study. The research team analyzed results from the Global Burden of Diseases, Injuries, and Risk Factor Studies, they called that the GBD study, in 2019, to inform cancer control planning efforts globally. And in 2019, globally, the risk factors included in this analysis, these are things like smoking cigarettes, the risk factors, things that will increase your likelihood of developing cancer, accounted for 4.45 million deaths, and that represents 44.4% of all cancer deaths in the study. The other portion is the type of cancer death that occurs from something that hasn't been triggered by a risky behavior. And we'll talk about these risky behaviors later, but just to put the most common one out, smoking. As we talked about, there is a genetic consequence at play here too. There are people whose genes are just predisposed to developing cancer. And you can be put on that path from the day you're born, regardless of if you've partaked in risky behavior or not. But this fact is so astounding, I want to linger on that. 44.4% of all cancer deaths are highly correlated with risk factors in general. Now, if you break this down between men and women, 50.6% of male cancer deaths are risk attributable. So more than half are being compounded by risky behavior. For females, it's less. 36.3% of female cancer deaths are risk attributable. So not the baseline genetics, but things that people do. So now we get to the crux of it. What are these risk factors? There are three major ones that were identified in this study. It says the leading risk factors for risk attributable cancer deaths in 2019 for both sexes were smoking, number one. Number two, this might surprise you, alcohol consumption. And three, having a high BMI. So this correlates with things like being overweight. Now, at this point in history, I do believe it's pretty common knowledge that smoking is an extremely risky behavior that does heighten your risk of developing cancer exponentially. But alcohol consumption is seldomly thought of as being in that same category. People will drink a ton and not worry about cancer. They'll worry about a hangover. But with the rates that some people drink, they might actually be doing more harm than if they were to substitute that behavior with smoking cigarettes. And that's crazy to think about. And the third factor here is something that the West is completely heading in the wrong direction on. High BMI, obesity continues to grow year after year. A major problem. And if that's a risk factor that's highly correlated with preventable cancer death, we can expect these numbers to increase from here. The American US adult obesity rate sits at above 42%. That's almost 1 in 2 adults being classified as obese, and that's not even looking at overweight. If you factor that in, this is probably over half of Americans who have a BMI challenge. The study then goes on to report that from 2010 to 2019, global risk attributable cancer deaths actually increased by 20.4%. And if you look at these key factors that were listed, cigarette smoking, which actually is on the increase in certain pockets of the world, alcohol consumption, which is great pretty much all over the world, and a high BMI, which is currently unique to a lot of Western countries, but developing nations are catching up on that. We're at an interesting point in human history where things like hunger are becoming less of a problem than things like a surplus of calories. Now, of course, there's still a ways to go. Hunger-related issues still exist, and they're going to be here for quite some time, but we've been tackling that issue quite successfully over the past couple decades. We're in a vastly improved situation than we were in the early 1900s, for example. Now, just to rewind, that stat we just talked about, the fact that global risk attributable cancer deaths have actually increased over the past 9 years is quite sad because that's a figure that we can do a lot about. Now, just to be clear, it's not like if the world abandoned smoking, drinking, and calorie-dense foods that are unhealthy, that 20.4% increase would go to zero. Because as we talked about, these buckets are highly correlated. The risk factors might be exacerbating genetic underlying conditions. But one thing is sure though, if we got the risk attributable behavior down, the rates would decrease. And probably decrease by a significant number at that. The article follows this line of thinking by then saying that the leading risk factors contributing to global cancer burden in 2019 were behavioral. Reducing exposure to these modifiable risk factors would decrease cancer mortality rates worldwide. And, further, they say policies should be tailored appropriately to local cancer risk factor burdens. So, for example, if smoking is a major issue in your country, like in places such as Japan, it is getting better though, then tailor your policies to these heightened risk factors at the local level. In America, perhaps the BMI one is a bigger issue to look after. Now, cancer overall is the second leading cause of death worldwide. Some are preventable, some are not. This entire study is simply saying in a nutshell, look at what is preventable, and let's do what we can to prevent it. We won't end cancer by stopping risky behavior, but we can certainly get these numbers down. And for a disease as horrifying, as impactful, and as death-bringing as cancer, it's something that we should be doing. Now, this study is very concerned with policy prescriptions, and I do want to spend some time talking about that. I am in no way in favor of policies that are draconian. For example, banning these products. That's been tried before. Prohibition with alcohol, although it wasn't because of health reasons, but still, it was a complete disaster. I believe the same thing would happen again if that was tried. It doesn't make sense to ban unhealthy food, or alcohol, or smoking. It's just not compatible with the goals that we want to see at the end of the day. These things often bring new challenges of their own. But what can we do? First of all, the government has to get serious about education. They've gotten there with cigarettes, but it took much lobbying. It took a long time. Why? Because the cigarette companies were big, massive, and they were able to influence politicians up until the public woke up and demanded that they do something about it. Now, there are things like warning labels on cigarettes and stuff like that, but it was a struggle to get there. And I do encourage you to look up that history if you're wondering just how rough that battle really was. It was obvious to everyone that these were dangerous products, but the government dragged their feet to get these protocols and warnings developed. Now, on the alcohol front, it's even more obscure. Do people really associate alcohol consumption with increasing their cancer rate? The answer is no. Many people have no idea that correlation even exists. Will the government want to do something about that? Well, I'm doubtful. I'm skeptical. Maybe the answer has to lie somewhere else, because if we learned anything from the tobacco lobbies, the alcohol lobby will probably follow suit, and they'll make this a very challenging, a very grueling process. And who knows, the governments may stand to lose a substantial tax revenue piece of their budget. It's funny because I was reading an article about Japan where young people are drinking less these days and the government is actually upset about that. Then you have that other risk factor, the high BMIs, which come with many swaths of healthcare issues beyond just cancer. We're talking about things like heart disease, and the impacts that that's causing on the healthcare system are simply astronomical. And what can be done about that? Well, in Canada, a couple ideas were floated. I believe there was something along the lines of a junk food tax where they make it more expensive to indulge in things that are bad for you. Well, how about the opposite? Making it cheaper to indulge in things that are good for you. And it goes back to that an ounce of prevention is worth a pound of cure. To treat someone with underlying health issues as a direct result of obesity is immense, and they're typically lengthy procedures and treatment plans. To tackle that issue early on, to prevent 40%, for example, in America, of the population becoming obese to begin with, that's a good place to start. For not only the bottom line of government budget, but for the overall health of a nation is simply not healthy. And that goes beyond just your longevity. It goes beyond things like the limits placed on your lifestyle once you do become obese. These things are not good for a country to adopt as normal. And this is not incompatible with things like showing compassion to people. Fat shaming, or however you want to label such behavior, is not what I'm prescribing here. I'm simply advocating for being realistic about the massive negative consequences that have come from our insane eating habits as a country, as countries in the West. If I were to summarize the gist of this article, it is this. Simply put, a lot of the world's misery you can do something about. There are many things at the behavioral level that if changed would reduce a ton of death and disease that we witness on the daily. You have more power than perhaps you realize, and maybe the answers aren't all at the government policy level. I'm sure that would definitely be helpful, but at the individual, at the community level, there's certainly things that we can be doing to encourage better behavior. Now with that, it does bring us to the end of our conversation for today. If you enjoyed the article and our discussion, do feel free to leave a review. They'll help us grow. And you can find me online at perryplatform.org and on social media at perryplatform. Thanks for joining me, and I'll see you soon.